Hi everyone. Very happy to be here today. I had a summary slide as an overview of our session, and I'm going to see if I am able to share my screen appropriately. I think I can. Can you all see my screen?
Yes.
Wonderful. It's kind of okay. So we will have presentations today that will focus on three federal environmental health and justice mapping tools. Actually, four, because one of the presentations is going to talk about two different tools. So we will get started with CDC's Environmental Justice Index, and this will be presented by Dr. Sharunda Buchanan and Ben McKenzie. Then we will have EPA's EJ screen and the new eGEM tool, which will be presented by Mark Corrales from the US EPA. Then we will have a presentation on the Climate and Economic Justice Screening Tool, CJUST, and this will be presented by Dr. Natasha DeJarnett and Dr. Marcus Hendricks from the White House Council on Environmental Quality. So if Dr. Buchanan is ready, I would stop sharing and ask her to so I will stop sharing, and I would ask Dr. Buchanan to pull up her slides, and I will be introducing now both presenters. So if you hold on just a second, I'll get their presentation, their bios up. So Dr. Sharunda Buchanan is currently serving in a dual role. She is the director of CDC's National Center for Environmental Health at the Agency for Toxic Substances and Disease Registry, Office of Priority Projects, Innovation, and Environmental Justice. Dr. Buchanan has served at CDC for over 30 years. Concurrently, she has just been named as interim director of the Department of Health and Human Services Office of Environmental Justice within the Office of Climate Change and Health Equity in the Office of the Assistant Secretary for Health. Additionally, Dr. Buchanan is HHS's representative and co-lead of the LED subcommittee of the Presidential Task Force on Environmental Health Risks and Safety Risks for Children. In sum, Dr. Buchanan is committed to advancing health equity, attaining environmental justice, and improving environmental public health across the country. Dr. Buchanan, would you prefer if I also introduced Benjamin McKenzie right away or after your presentation?
Whatever you feel is best, Raquel.
So I think I'll present him right away so that among the two of you, you can then navigate transitions. So Ben McKenzie is also with CDC and he coordinated the Environmental Justice Index development. He's a geospatial epidemiologist. So he works with the Geospatial Research Analysis and Services Program, also known as GRASP, and he, since 2021, has served as the team lead for the Environmental Justice Project in collaboration with the National Center for Environmental Health and the HHS Office of Environmental Justice. He's a graduate of Auburn University in Alabama and Sinawi, the University of the South in Tennessee. Mr. McKenzie is a committed advocate for the application of geospatial sciences to promote health and health equity. So I will now pass on to Dr. Buchanan and Ben McKenzie, who will talk to us about the Environmental Justice Index. Before they start, just letting everyone know that we will then have a presentation by Mark Corrales, and afterwards by the two presenters from the White House Council on Environmental Quality. And at the end, we will have time for questions. So if you have questions, just put them on the chat, and Natalie and I will be monitoring the chat for that purpose. Thank you, and Dr. Buchanan.
Thank
Get
you so
going.
much. Hopefully everybody can hear me okay. Good afternoon, everyone. Thank you for having me today. It's a pleasure to be a part of this mid-year meeting. And I'm happy to be presenting with my colleague, Benjamin McKenzie. As Raquel mentioned, I'm Dr. Sharunda Buchanan, and I go by the pronouns she and her. I'm actually wearing a pink blouse with a blue blazer, and happy to be presenting on the Environmental Justice Index today. Ben, I believe you'll be advancing the slides. Great, thank you. I'd like to start off with the presentation objectives and bring the first one into our view. We just have a threefold objective today: to bring attention to the intersection of health equity and environmental justice. Second, we want to highlight social and physical and environmental factors that serve as underlying determinants of health. And then thirdly, we want to demonstrate the utility of the Environmental Justice Index as it addresses determinants of health in pursuit of environmental justice and health equity. I always like to start off with terminology to put us all on the same page. And let's start with health equity. What does that mean? Striving for the highest possible standard of health for all people and giving special attention to the needs of those at greatest risk of poor health based on social conditions. Health disparities. Differences in health outcomes and their determinants among segments of the population as defined by social, demographic, environmental, or geographic category. Social determinants of health. These are conditions in the places where people live, learn, work, and play that affect a wide range of health and quality of life risk and outcomes. And then last but not least, environmental justice. Advancing health equity and eliminating environmental health disparities through the fair treatment and meaningful involvement of all people in environmental health policies, research, and programs, and ensuring equal access to a healthy environment. Next slide, please. You'll always hear me say that environmental justice and health equity are inextricably linked. If you find an environmental injustice, 99.9% of the time, you're going to find a health disparity. The two are inextricably linked. I provided some examples here for you. Over 42 million American homes suffer from energy poverty, making them vulnerable to intense heat and cold. More than 2 million Americans live without basic access to safe drinking water and sanitation. And then the last example is 11.9 million Americans, most of these are disproportionately people of color, are exposed to unhealthy air pollution levels. Again, environmental justice and health equity are inextricably linked. Next slide, please. So as Raquel mentioned, I'm serving in a dual role. I'm named as Interim Director of the Office of Environmental Justice at HHS. The Office of Environmental Justice was established within the HHS Office of Climate Change and Health Equity, within the Office of the Assistant Secretary for Health at HHS on May 31st, 2022, as a result of the Executive Order 14008. My office serves as a departmental-wide hub for leading initiatives that integrate environmental justice into all of HHS's mission to improve health in environmental justice community and for vulnerable populations across the nation. Our very mission is to protect the health of disadvantaged communities and vulnerable populations on the front lines of pollution and other environmental hazards that affect health. Our ultimate goal here at OEJ is to be a resource for underserved and overlooked communities. Next slide, please. So I'd like to just focus in on social determinants of health just for a second. Healthy People 2030, for which most of us are familiar with, uses a place-based framework that outlines 5 key areas of social determinants of health. First, healthcare access and quality. Second, neighborhood and built environment. Thirdly, social and community context. Fourth, economic stability. And finally, and fifth, education access and quality. It's these social determinants of health and the cumulative aspects of all of what's involved here that begs for us to look at this thing in a cohesive and collaborative manner. Next slide, please. I always like to mention the intersection of social determinants of health, environmental health disparities, and health equity. So as we look about the description here, and this is sort of a animated slide here, and thinking about the origins of some of what we are facing in the communities that we have discussed and talked about as being disadvantaged or underserved or overburdened, and thinking about some of the effects, the impacts that these communities are actually experiencing. Looking on the right-hand side of this graphic here in terms of energy and housing and food insecurity, these are issues that our communities are having to deal with. There's also the concept of heat islands and unsafe water, and many of these unpleasant and unhealthy issues that really impact our communities. We looked at worsened mental health and pollution exposure and climate migration. These are all things that are affecting communities from a holistic and cumulative aspect. As we look about the origin of some of these, we think about what happened in the first place. What is some of the causes of some of this? And here's where we focus in on systemic racism and some of the redlining that happened years ago that has made way for a lot of this legacy pollution that we're experiencing. And then that in turn has resulted in disinvestment in our communities. But as we look at all of this, the impacts and the origins, all of this taken together brings about the fact that we're looking at a cumulative nature of what's affecting environmental justice community for the long haul. And it's been affecting those communities for a very long time. Next slide, please. Finally, I just wanted to present that so we can really key up and think about what my colleague Benjamin McKenzie is about to present as we're thinking about the cumulative nature and think about all of what's affecting a community. So with that, I will turn it over to my colleague, Benjamin McKenzie. Ben, take it away.
Thank you so much, Dr. Buchanan. And I'm so honored to have the opportunity to address you all today and to talk a little bit about our Environmental Justice Index. As Raquel mentioned, my name is Ben McKenzie. My pronouns are he, him. For descriptive purposes, I'm wearing a light blue shirt and have a blue CDC background behind me. So I'll go ahead and talk about our Environmental Justice Index, which we developed in association with the HHS Office of Environmental Justice and released on August 10th, 2022, with the launch of a website at eji.cdc.gov, as well as a publicly available mapping tool called the Environmental Justice Index Explorer, which allows users to interact with our maps and data. So the EJI was developed as a tool to address environmental injustice and health disparities by measuring and visualizing where U.S. communities are facing the cumulative impacts of environmental burden on their health and well-being. And that phrase cumulative impacts is a key one. We've heard it many times today. In short, it refers to the multiple environmental, social, and other stressors present at the community level that build on each other and interact to produce patterns of health and well-being. A concept that's really intertwined with those social determinants of health that Dr. Buchanan mentioned a moment ago, and which I know many on this call will be very familiar with. The EJI assigns a single screening level score to communities across the United States that represents these cumulative impacts of environmental burden on health. Now, I do want to make sure to say that the EJI is not a tool for labeling environmental justice communities or disadvantaged communities. Instead, what the Environmental Justice Index does is to provide that single score representing relative cumulative impacts. I'll talk about why that's so important in a moment. but that score is not intended as a definitive label, but rather as a tool for contrast and comparison. In doing this, the EJI builds on existing environmental justice and cumulative impacts screening tools and methods, taking a framework that was originally actually developed for measuring cumulative impacts at the state level with tools like the Environmental Justice Screening Method and CalEnviroScreen, and applying that framework nationally in response to calls for a nationwide approach to measuring the impacts of environment and injustice on health. So the EJI is calculated and displayed at the level of the US Census Tract. Census tracts, for those who aren't familiar, are subdivisions of counties for which the US Census collects data. They have a average population of about 4,000 people, and they're commonly used to show neighborhoods in place-based epidemiological research, where it's really useful to have that kind of granular level of data on population characteristics. There are about 72,000 populated census tracts in the United States, and EJI scores are available for most of these, with notable exceptions in Alaska, Hawaii, and US territories where we don't have sufficient environmental data to draw comparisons, though that's something that we're working towards addressing in the next iteration of our tool to provide what data we can for those areas. The overall Environmental Justice Index consists of 3 modules, representing what we see as the 3 building blocks of cumulative impacts: environmental burden, social vulnerability, and health vulnerability, all of which are interacting and building on each other to produce patterns of health outcomes and health disparities, that kind of holistic overview of social determinants of health. These 3 modules include a total of 36 individual indicators, each calculated using nationally representative data sets from the US Census, the US Environmental Protection Agency, the US Mine Safety and Health Administration, and the CDC. And each of those indicators represents a distinct environmental, social, or chronic health condition that contributes to overall cumulative impacts on health, building on each other to influence health and well-being. The EJI calculates this cumulative impact score using a percentile ranking method, which essentially means that scores for individual census tracts in the index represent comparisons to all other census tracts along a 0 to 1 scale. So, for example, an EJI score of 0.85 for a given tract would indicate that that tract in question experiences more severe cumulative impacts on health than 85% of all other tracts in the nation. So again, you can see what this tool is really designed to do is to offer context and comparison for issues of environmental justice and health equity at the community level. These methods are peer-reviewed and tested. Again, they've been used widely by other tools using that environmental justice screening method. They're also relatively simple and easy to communicate to a range of users with varying backgrounds, making them also easy to adapt to local needs and circumstances. So with all of that information in mind, I want to quickly show you how to learn more about the EJI and interact with our data at our website at eji.cdc.gov, shown here on the right, which includes a wealth of information on the EJI. But you can also navigate from this page to our EJI Explorer, which allows you to view EJI data through an interactive mapping interface. So I'll go ahead and show you a little bit of what that looks like. This is the Environmental Justice Index Explorer, again, an online tool open to the public that can be used to visualize and interact with EJI data. Here at the top, we have our vision for the EJI, measuring cumulative impacts to build towards a cleaner, healthier, and more equitable future for everyone. We also have links for accessible data option for the vision impaired, an email address to submit feedback on the EJI. We really like receiving feedback or ideas. And then finally, a option for data download. Now, the database that's available through this data download option includes both the overall index score at the census tract level, as well as scores for all of the different modules, domains, and indicators that go into calculating the overall environmental justice index score. We also in that database include raw indicator values, the underlying data that's used to calculate the index. The map is the real star of the show here. though. It displays relative ranks for cumulative impacts around the nation, grouped into quartiles, meaning that the tracts shown in the darkest shade here experience more severe cumulative impacts on health than at least 75% of all other tracts in the nation. Again, these data are intended to provide a high-level context and comparison at the community level, helping us to hone in on areas experiencing the most severe cumulative impacts relative to other tracts in the nation. That said, this high-level map is really just the highest level at which users can interact with the data using the EJI Explorer. The Quick Start Guide shown here on the left also walks users through ways to focus in on areas of interest in order to dig deeper into that data. For example, I'll use DeKalb County, Georgia, which is where I live and work. And applying a county filter, as shown here on the screen, will take users to that county, giving them a broad overview of the relative cumulative impacts across the area. Selecting a particular census tract in that map brings up this pop-up that gives users information like the population for that tract, as well as percentile rank scores for overall cumulative impacts, as well as for those constituent pieces, environmental burden, social vulnerability, and all of the individual indicators included in that overall index calculation. You might also notice that scores are provided for functional groupings of indicators, such as all indicators of air pollution. Those are called domain rankings, and they're calculated very similarly to module scores by summing and percentile ranking all constituent indicators. You might also notice red symbols next to some of these scores. These symbols simply are visual indicators that the census tract that's selected ranks higher for that indicator, domain, or other score than 75% of all other census tracts in the United States. It's essentially an easy visual way of highlighting factors that may be contributing to high cumulative impact scores in that area. Users can also click on the indicators in the pop-up box here and be redirected to our website, again at eji.cdc.gov, which gives information on exactly what each indicator represents, the year or years that data for that indicator were collected, the source of the data, and the rationale for how that indicator contributes to overall cumulative impacts on health. This site also provides a lot of other additional information, including a downloadable fact sheet, a series of FAQs, and detailed technical documentation for those who really want to get into the weeds on theory, methods, and the scientific basis for the EJI. I also want to mention that EJI data is accessible through the National Environmental Public Health Tracking Program's Environmental Justice Dashboard and their Data Explorer. So if you're a user of the tracking network's excellent data and visualizations, you can also find EJI data there. So I want to end off with just one very important point, which is that we acknowledge that community engagement is a key part of environmental justice. It's part of that procedural justice, which is why, since the release of the EJI, we've been working to host live demos, webinars, and to participate in listening sessions in order to introduce communities, public health partners, and subject matter experts to the EJI, and to engage with them on our methods and communication around the tool. I also want to quickly mention that we have a series of upcoming community engagement events planned for the month of May, where community members, public health practitioners, and others can learn more about the methods and process behind our tool and provide feedback that we can use to improve our tool going forward, making it as representative as possible of the lived experiences of those facing injustice and its impacts on health. And with that, I'll go ahead. Thank you all for your time. I think we're doing questions at the end, so I'll turn it back over to Raquel to introduce the next speaker. Thank you.
Thank you so much, Ben and Dr. Buchanan. And we will now move to a presentation by Mark Corrales. And while he is setting up, I will just mention that we would like presenters to keep to 10 minutes or so if they can, so that we have time for questions at the end. And also, if you have questions, please post them on the chat. I hope Mark is ready to share his screen, and while he does that, I will introduce him, which is what I should have started already. So Mark is with the EPA's Office of Policy, where he's serving as a senior advisor on environmental justice in rulemaking. Back in 2010, he pitched the idea for a new tool called EJ Screen and was central to designing the EJ Index and other indicators. Today, he is managing the development of a new EJ tool that EPA will be calling eJAM, which he will be telling you more about. His educational background includes biology and public policy, especially quantitative analysis. Most of his work at EPA has focused on the review of national level environmental regulations, most recently as director of the Policy and Regulatory Analysis Division in EPA's Policy Office. So Mark, take it, and please keep to the 10 minutes if you can, even though it's two tools.
Thank you so much, Raquel, and everyone. I'm very much enjoying these presentations. They're excellent. I'm learning a lot. I will skip over some slides in the interest of time and recognizing that I may be standing between lunch and now. So I'm going to tell you a little bit about some of the specific things that EJ Screen and other tools can do. And I was going to put it in historical context, but thankfully Charles and others have already covered a lot of this. So, but essentially the point is that about 40 years ago, we were already trying to do EJ analysis. And I'm going to talk mostly from the federal regulatory perspective, just to mention that. But those prior analyses had really limited tools and limited data. You had to be a GIS expert, and they tended to focus on just one thing. Despite all those challenges, Charles and others managed to write the well-known report back in the 80s. So 20 years ago, there was a lot of focus on risk analysis, cost-benefit analysis. And again, there were some tools. EPA did have an office related to equity, but we did a count of EJ analyses supporting regulations, and they were quite rare. They did exist, but they were quite rare. Around 2008, Administrator Lisa Jackson came in, made EJ a priority. We saw a huge jump in the percentage of rules at EPA, national rules, that had an EJ analysis. And several different efforts started at that point around then. Coronavirus Screen, of course, eventually launched in 2013. EJ Screen, which I'll show you, went public in 2015 and has been updated regularly since then. The NEJAC, National Environmental Justice Advisory Committee, has played a really strong role. A lot of other tools that I'll skip over. There's been some slow progress since those years. There's also been an explosion of resources, data, discussion, and mapping tools, right? So there are many mapping tools that states have put together. This map shows where some of them are. CGEST we'll hear about later today. And I want to mention that I will share these slides, and I have a long list of resources for you that lists some of the best reports that compare these different mapping tools. So there are some studies that have sort of listed the various tools and tried to compare them. Some of those are pretty recent. There are a lot of federal resources I've listed for you, and there's some that are not specifically EJ, but are relevant. So those will be in the slides. So why would you use EJ Screen? And I think it's important to think about that because there's so many tools out there now, it's hard to sort through which ones do what and why you would use one or the other. EJ Screen is great if you want to describe one place in terms of demographics and environmental stressors and how those come together in combination as an EJ index. A lot of the same things that the CDC tool can do, EJ Screen does similar things. EJ Screen puts it in context, like the CDC tool, by expressing things as percentiles. So you can compare, see how do you compare to the rest of the state or the nation. It also looks at multiple stressors all on one page. So it gets at that issue of cumulative. It doesn't add them together, but it shows you all of them together and at one point. It gives you a map of a county also, and you can see hotspots. So it has some really good strengths. It's easy to access. It's not just one office like the old tools used to be. It's consistent across states. It standardizes things. It's well supported institutionally. I think it does very high resolution accurate buffering. In fact, it goes down to what's called the block group resolution, which is smaller than a tract. And it actually even does calculations block by block, and then it summarizes those by block group. So it's been peer reviewed. It's being reviewed by the Science Advisory Board right now. And so let me just give you a quick look at it. But like I said, I think it is quite similar to some other tools that you've already seen. This is what it looks like. There is, of course, a web page, which I've provided the link for. It has a lot of details about how it was developed, how to use it, walkthroughs. It's a basic mapping tool. It has environmental justice indexes, which you can map, and you can see locations that have higher or lower scores. The color coding is percentile based, like CDC's tool. You can also look specifically at just an environmental factor like traffic in this case. It has some health disparity metrics. So a lot of this is probably familiar from what you've seen before. There's a new feature, which is the threshold map widget. What that does is it lets you say, I want to look only at places that have six or more of all these indexes above some cutoff. So it's a way to filter the map down to a subset of places that have sort of more cumulative impacts. And one of the key things you can do with EJ Screen is you can get a report. So you can draw, you pick a point, and you can say, tell me about everyone who lives within 1 mile of this point. And so it creates a report like this, which is everyone within 1 mile. Here are the EJ indexes, comparisons to the state and country, a map, and all the raw numbers for this one location. Okay. And I'm not going to walk through this in the interest of time. What EJ Screen cannot do so well is it's not designed to be used for regulatory analysis and decisions. It does not look at multiple locations. It's one report at a time. So if you wanted 100 reports, there's not an easy way to do that. And it's somewhat inflexible in terms of how often you're able to update some features. I will skip some slides about other tools, and I will jump over to tell you a little bit about eJAM. So eJAM is an effort to try to do the same thing, but for hundreds of sites at once. So this is an interim tool that we've started testing internally. It's still very much work in progress, but this is a way that you can upload a list of, here in this case, 50 sites. It draws a map of those, and those are based on latitude, longitude. I can say, okay, this is site number 42, and I can adjust the radius of interest. So I can look at everyone within, let's say, 3.2 miles, and then I can run this analysis. Now, this is using the existing EJ Screen tool. It's not available to the it's really not even available yet within EPA. And it is based on using EJ Screen 50 times in a row. So It takes a little bit of time, and you can see it's getting towards done there. But so this is sort of the interim tool that we have. But the nice thing about this is it gives us a report where every row is one facility. So facility number one, I can see is, and I can sort these. For example, if I want to know which of these had a high percent low income, I can see immediately this one had 55% of the people near this site were low income. And then I can go over and grab the EJ screen report for just that one facility. So this is pretty snappy. It works okay. Unfortunately, this portion of it doesn't give you a summary overall. It tells you for any one site, what are the stats. So what I've been working on is sort of the next part of EJAM, which is this. And what this does is it will eventually allow you to, again, select 50 locations. And then there are other ways to you can select a whole industry, you can select facility IDs, you can search in the Echo database, and you'll be able to start an analysis, and that's done already. So it's way faster than the other approach. We just got 50 results pretty much instantly. There are 1 million people that live within a mile of any of these 50 places. This report looks a lot like the EJ screen report, but it's for 50 places summarized all together. So it tells me that, for example, percent low income for those 1 million people that live anywhere within a mile of any of these places, it's 42% low income. And I can see in the US overall, 30%. So the ratio is 1.4. So this is, the percent low income is 1.4 times as high for these people as it is in the country overall. So these ratios are a way of comparing. And then there's, of course, some graphics we're working on. There's a map, and there are the environmental metrics treated in a similar way, and you will be able to download the report. So that's kind of in a nutshell what the EJ screen and future EJAM tools do. How are we doing on time?
Ready for going forward to the next presenters, if that's okay.
Okay, let me show you one slide that has my thoughts on the future here then. I think these are kind of the key questions that come to my mind when I'm thinking about where are we going with some of this analysis. The first question obviously is, should I believe these numbers? Is it accurate? We do need better resolution. That's just one of many things we need. A lot of the tools use a sort of an approximation of who lives near this facility. That's not all that great, frankly, because it used to be hard to do that quickly. The second question, what's the full picture? That's the issue of cumulative, and we've already talked about it. We need to include more demographic subgroups. EJAM has, for example, percent Hispanic, which is not yet in a lot of these other tools. What's their point of view? That's the issue of participatory approaches are needed. We can't just do this analysis and say, here's the answer. What is your point? This is a pet peeve of mine. I am seeing so many tools with so many numbers that people are overwhelmed. They don't know how to make sense of it. You give them a spreadsheet with 200 indicators and 200 facilities, or 200 indicators for each facility. What does this mean? There are not enough people whose job it is to think about that and figure out how to explain it, frankly. And then finally, maybe the most important one, what's the point here? What's the point of this in the sense of why are we doing this analysis? Is there some decision or action that will be different because of this analysis, or so that it's not just a paper exercise. So I'll stop there. Thank you. Sorry for the whirlwind tour.
So we will now move to our final two speakers, Dr. Natasha DeJarnett and Dr. Marcus Hendricks from the White House Council on Environmental Quality, and they will present on Climate and Economic Justice Screening Tool, CJEST. So while they get ready, I will introduce them. So Dr. DeJarnett is the Deputy Director for Environmental Justice Data and Evaluation at the White House Council on Environmental Quality. Most recently, Dr. DeJarnett served as an assistant professor in the Christina Lee Brown Envirom Institute at the University of Louisville Division of Environmental Medicine. She was researching the health impacts of extreme heat exposure and environmental health disparities. Dr. Marcus Hendricks is a senior advisor for climate and community resilience on the inaugural environmental justice team at the White House Council on Environmental Quality as well. Prior to joining CEQ, Dr. Hendricks recently received tenure as an associate professor of urban studies and planning, and he's the director of the Stormwater Infrastructure Resilience and Justice Lab at the University of Maryland. While at the University of Maryland, he was selected as one of the 50 emerging leaders or fixers in the 2021 GREASed 50. He has served on the U.S. Environmental Protection Agency's Science Advisory Board and was an author on the Human Social Systems chapter of the U.S. Fifth National Climate Assessment. So take it, and please again, keep to the 10 minutes if you can, so that we can ask some questions. Thank you so much.
Thank you so much for the very kind introduction, Raquel, and we will do our absolute best. We are so excited to be here with you amongst friends, sharing about the Climate and Economic Justice Screening Tool version 1.0. So I am Dr. Natasha DeJarnett, Deputy Director for Environmental Justice Data and Evaluation here at the White House Council on Environmental Quality. And I'm also pleased to introduce my colleague, Dr. Marcus Hendricks, Senior Advisor for Climate and Community Resilience, who you'll hear from shortly. And certainly want to acknowledge CEQ's entire environmental justice team, some of which are here joining us today under the leadership of Dr. Jalon White-Newsome, the 2022 Calver Awardee, and of course, CEQ Chair Brenda Mallory. And also want to acknowledge our partners at U.S. Digital Service who contributed to CJEST version 1.0, as you'll see today. The Climate and Economic Justice Screening Tool version 1.0 is a valuable step in delivering on the administration's environmental justice commitments as well as its Justice 40 goals. So we're excited to discuss version 1.0 of the CJEST with you today. Version 1.0 was launched on November 22nd, 2022, and federal agencies are using the tool to help identify disadvantaged communities who are the communities slated to benefit from the Justice 40 initiative. Version 1.0 responds to extensive feedback that we received on the beta version of the CJEST. We had over 3,000 comments, emails, or survey responses that provided feedback on the beta version, much of which we've been able to incorporate into version 1.0. President Biden signed Executive Order 14008 on tackling the climate crisis at home and abroad during his first week in office. This executive order charged the Council on Environmental Quality with creating a geospatial climate and economic justice screening tool and publishing interactive maps highlighting disadvantaged communities. Executive Order 14008 also created the Justice 40 initiative. The Biden-Harris administration's Justice 40 initiative seeks to deliver 40% of the overall benefits of certain federal investments to disadvantaged communities that have been marginalized and overburdened by pollution and underinvestment in the areas that are shown on the slide. The Justice 40 initiative is a series of changes by agencies. This is not a one-time investment and not a single pot of money. It applies to certain existing programs and certain new programs, including the Inflation Reduction Act, the Infrastructure Investment and Jobs Act, and the American Rescue Plan. And now I'll turn it over to Dr. Marcus Hendricks to share about the CGIS methodology.
Thanks so much, Natasha. For the CGIS methodology, communities are considered disadvantaged if they are in census tracts that meet the threshold for at least one of the two categories of burden. In addition, communities are also considered disadvantaged if they are on the lands of federally recognized tribes. In the CGIS tool, the burdens are categorized according to areas that relate to both the Justice 40 areas of investment, as well as how President Biden describes disadvantaged communities in the executive order, including categories of climate change, energy, transportation, housing, legacy pollution, water and wastewater, health, and workforce development. A community is highlighted as disadvantaged on the CGIS map if it is in a census tract that is at or above the threshold for one or more of the burden indicators, and if that tract is at or above the threshold for an associated socioeconomic burden. The low-income threshold is set at the 65th percentile for all categories that use that indicator, with the exception of workforce development, which I will come back to in a moment. Overall, there are a little over 27,000 census tracts that are identified as disadvantaged in version 1 of the CGIS. I'll share an example of the methodology behind the climate burden category. I also encourage you to view the CGIS website under the data and methodology page to see the methodology along with documentation of the data sets used for each burden category. But you can see them all summarized on this slide and the following slide. For climate change, communities are identified as disadvantaged if they are in a census tract that are at or above the 90th percentile for expected building, agriculture, or population loss rate, or projected flood or wildfire risk, and are at or above the 65th percentile for low income. For health, communities are identified as disadvantaged if they are in census tracts that are or at or above the 90th percentile for asthma or diabetes or heart disease or low life expectancy, and are at or above the 65th percentile for low income. For workforce development, communities are identified as disadvantaged if they are in census tracts that are or at or above the 90th percentile for low median income or poverty or linguistic isolation or unemployment, and fewer than 10% of people ages 25 or older have a high school diploma, high school education. In addition, a census tract that is completely surrounded by disadvantaged communities and is at or above the 50th percentile for low income is also considered disadvantaged. The guidance and instructions provide direction to federal agencies on how to use the CGIS. These are available publicly on the screening tool website. CEQ is also available to help any federal agencies that need additional assistance in understanding how to use the CGIS for resource allocation purposes. You can direct questions to screeningtool-support@omb.eop.gov. We also discuss all of the changes between the beta version and version 1.0 in the webinar that we hosted on November 22nd of 2022, the day we launched version 1.0. You can find this video by Googling White House CGIS webinar. It's also available on the CGIS website on the public engagement page. We will now transition to a brief online demonstration of the screening tool, as well as using the spreadsheets from Dr. Natasha. I'll pass it back to you, Natasha.
Thanks so much. Bear with me just a moment as I get the screen set up to share. Okay, so as you can tell, we are very excited to share this very useful resource. If you go to screeningtool.geoplatform.gov, this is where you'll land on the Explore the Map page. We'll come back to this page in just a moment, but I'll give you a snapshot of some other features to be aware of on the CGIS website. If you click on About and then click on About, then you can find more information about the CJIS. You can also find the memo that offers guidance to federal agencies on using the CJIS, as well as instructions to federal agencies on using the CJIS. And then if you click on the methodology and data page, which you can see I've already pre-populated these. If you go to that page, that's where you can find the thresholds that are utilized for each of the different burden categories that Dr. Hendricks pointed out, as well as the links to the data sets that are actually providing the data that you see there. In addition, if you click on methodology and data, go to the downloads page. This is where you can actually download the Excel file, the shape files, as well as technical support documents for the CJIS. But I do want to give you a quick demonstration of the tool. So here I have typed in Birmingham, Alabama, and you can see we are here located in Birmingham, Alabama. So this is what you'll see. You can type in a city and state like I did. You can type in just the city. You can type in a zip code. And in many cases, you can even type in a landmark and it'll take you to that location. So we'll click here for this particular community in Birmingham, Alabama. You pretty quickly see that it is identified as disadvantaged. As it says, it is identified as disadvantaged, highlighted yes in blue. And the reasons for that are highlighted in blue here. So for each of these different burden categories, it has exceeded the threshold. For climate change, it exceeds the threshold on the expected building loss rate, in addition to this particular census tract being low income. If we zoom out, let's go to an area that's not shaded dark, and we can see this particular community. We can see this particular community is not coming up for any, or none of these burden categories are highlighted. And it says here that this community is not identified as disadvantaged. So that is a difference between a community that is flagged as disadvantaged and not in the CJIS. Then I also want to give you an example of a community that is partially disadvantaged. So we type in Oneida County, New York, and click here, we see that this community is partially disadvantaged, and the explanation is right below, because the lands of federally recognized tribes cover 45% of this tract. So with that, happy to share with you about the CJIS, happy to take questions about the CJIS, and excited to hand the microphone back to our moderator to lead our Q&A discussion.
Thank you